Hi, so this is Angie Tells All, and today I'm talking about my pregnancy, which is probably what this channel will mainly be about, because I just needed a place where I could come and vent and talk about how I'm feeling and kind of document my experience, I guess, because it's been an interesting road so far. And my first video does have an intro and outro for 3 Shepherds and a Mutt. That is my other channel. I do want to keep that going, but due to my pregnancy and some other health conditions, I haven't been able to post there as much as I would like in months. So this is about pregnancy. So this is my tell-all about my first trimester, pretty much. And I have a drink here. This is one of my new favorite things. I can't drink a lot of it because it tastes really sweet, but it's basically just Skittles packet water mixer. So I mix that with water and put it in my Dunkin' Donuts cup. It's really good. Okay. So let's talk about the first trimester of pregnancy. For a lot of women, it can be rough. For me, it was rougher. So I'm just going to start at the beginning and go all the way through all the details, because this is a tell-all. Alright, so September the 27th was my last menstrual period, and in October, right around when I would have been expecting my cycle, I wasn't too concerned. Of course, I thought there was a possibility that I could be pregnant, but my cycles had kind of been messed up for quite a while, so it really wasn't like in the forefront of my mind that I was pregnant. But the first day that I tested, it was before Halloween, and I was like a day late at that point. So we were going to go out for Chinese, and that's the reason I tested, because the Chinese place that we go to has sushi, and that's always my go-to, my favorite. I love it. Can't get enough of it. So, of course, I wouldn't eat Chinese if I knew I was pregnant, especially in the first trimester when all the important developmental stuff is going on. So I wasn't really thinking, oh yeah, I'm pregnant, but I was late. And because previously my cycles had been messed up, you know, I thought, well, it's going to come in a couple days, but I'm just going to test to check to make sure, you know, since I'm planning on having food that could be, you know, contaminated and cause issues in a pregnancy if you were pregnant. So that was my thinking. So my husband picked up 3 cheapy tests. 2 of them were for signals, and that's like Walmart carries the first signal. Sorry, I'm just getting over a cold. Walmart carries first signal. The dollar stores usually do. So he got 2 of the first signals from Family Dollar, and he was in the Dollar Tree, so he just decided to pick up one of the Dollar Tree tests, excuse me, as well. So told him I was going to test, or wanted to test. He picked up the tests, brought them home, and I did a first signal, and it came up with a line pretty much right away. So then I did the second first signal, and it also had a line, but here's the thing, and here's the reason I took all 3 tests. The second first signal had a line, and it came up pretty immediately, but it was a little bit lighter than the first signal that I took. So I'm like, well, are these dud tests? Is this something like happening? Like, is this the beginning of like a true positive pregnancy test? I didn't know. So I did the Dollar Tree test, and that one came up darker. I think darker than either of the first signals. So I'm like, okay, well, I'm not having sushi tonight. And I didn't. I think I had like the California roll and some fried, like, it was all the safe stuff. And this is a tangent, but I'm just going to say it. Like, I think that's a difference between like Western culture and Eastern culture, because in Eastern culture, they eat that kind of stuff throughout their pregnancies, and they don't give a second thought to it. But I live in the United States, and our Food and Drug Administration and our U.S. Department of Agriculture aren't really what you would call like the gold standard. We are way behind like the European Union and stuff like that. So food gets contaminated, I feel like way more often. So in any case, side tangent, that's why I decided to pass on the sushi. So I did. And that brings us to the next day. So the next day, I was at Walmart and I got a pack of Clear Blue tests, the early result and a digital. Like, it was just the one pack. Like, I didn't buy two separate tests. Like, it was one box, but those two tests were in it. And I took the early response first. And if you're interested, or if you're curious about how to take a pregnancy test, or you think you might be pregnant, you don't know, and you just want to see how the tests are done, that video is already uploaded. I didn't video me taking the 3 cheapy tests, but I did video the Clear Blue, and the early result came up like right away, and it was darker than any of the lines before. So I'm like, well, I've taken that one and it was positive. I may as well take the digital. So that's what I did. And the digital was also positive. And I think it wasn't until that point, and yes, I did have 4 tests that were obviously positive, but it really wasn't until I saw the digital that I'm like, okay, I'm pregnant. And one of the reasons for that is, I think, because of my age. I'm 43 now, and as you get older and your cycles start to kind of get uneven and stuff, and if you're entering perimenopause, it can happen that there's HCG in your urine because of your hormones and because of changes happening in your body that don't mean you're pregnant. So I think that's partly why I kind of didn't believe it. But when I saw the digital, I was like, well, I don't know how likely it would be. And I mean, I've never missed a cycle, but I did think I was perimenopausal. But I don't know how likely it would be that, you know, you would have 5 tests and they're all positive and you wouldn't be pregnant. So it kind of started to click in my mind at that point. So from there, I called my gynecologist, OBGYN. They're an OBGYN. And I'm like, well, you know, I got a positive test. Excuse me, I missed my period. I need to make an appointment. So I did. And they put me at December the 8th. So I had a little bit of a wait. I thought they would get you in sooner, but apparently not, because I think I was like around 10 weeks. Yeah, I was about 10 weeks at my first OB appointment, which isn't like too far out there, but I know a lot of places will try to get you in like 6 to 8 weeks. But in any case, that's what they scheduled me for. That's what it was. December the 8th was my first appointment. So between when I tested and December the 8th, my first appointment, when I first tested, I didn't really have a whole lot of symptoms. I was a little bit nauseous, but like during the next 2 weeks, like things got really bad. Like morning sickness was horrible, horrible. My stomach also started hurting. So not only was I having morning sickness, like I would have like stomach pains. And I had periodic headaches. I just felt awful. Like I felt, honestly, like I felt like I was getting like the flu, but I wasn't running a fever, but I was like really achy and really tired. Granted, all of these things are normal pregnancy symptoms, nothing abnormal, but it was just so extreme. And I just like, it was rough. It was very rough. And I'm not the type of person to like throw up a lot. Like, I have a pretty strong stomach, but I think like if I wasn't that type of person that has a really strong stomach, I would have been throwing up 24/7. I think I would have been diagnosed with what is that, hyperemesis gravidarum? I think I'm pronouncing that correctly. That's like a severe form of morning sickness where you can't keep anything down. I was keeping food down, but it's like every time I would eat, I would get nauseous. And I would go to the grocery store and I would see, like, one of the first food aversions I had were sweet things. And it still kind of makes me a little queasy, but I can now kind of eat like I'll kind of crave like something sweet, so I'll eat it, but it still kind of still makes me a little queasy, but not nearly as bad. In the first trimester, like, I could not, like, even looking at pictures of like candy bars or cupcakes or things like that, it would make me gag. Like, I would start gagging. It was bad. So the first trimester was very rough, and in addition to all that, I was also having cramping, which is also a normal pregnancy symptom, but it was worrisome for me, I guess, because it was in the back of my mind, well, your eggs aren't as high a quality as might not be. I mean, they can be, but usually the older eggs have more of a chance of having like chromosomal abnormalities and things like that. So it just felt constantly like I was going to get my period, but, I never had any spotting or anything like that, thank goodness, because that would have really, I have anxiety, so that would have really sent me over the edge. But it was always like a constant cramping, and like, it was pretty painful cramping too, and that brings me to my first OB appointment. So I had my first OB appointment on December the 8th. Let me back up just a little bit. I'm trying to keep this chronological. Let me just back up a minute before I talk about the first OB appointment. So I was having a lot of pain when urinating, and I have some other health problems, and I had been referred to a urologist before, and I never went. That was my bad, but I never went. But like, I get a lot of UTIs, but even when I don't have a UTI, I still have like a lot of pain when I urinate most of the time, especially before my period. Now, I've never had an issue with cysts. I don't have endometriosis, no problems like that reproductive wise, but just like the UTI stuff has been bad for me. So I'm like, well, I probably have another UTI, and I know those are common in pregnancy anyway. So I went to urgent care, and they gave me cephalexin because they did a urinalysis, and they're like, well, you do have a UTI, and we will culture it to see, if we need to switch your antibiotic, but we'll give you cephalexin. They also did a pregnancy test, which was positive. So I took the cephalexin, and even after I was off the cephalexin, like, I was still having pain when I urinated. So that brings us to the first OB appointment. So December the 8th, I went in, and, they did the weighing, they checked my vitals. They were going to do a pap test, but I declined that because of the cramping. Like, the cramping was bad, like I say. So I declined the pap. I've never had an abnormal pap, so I didn't see it as something that was like extremely necessary. So they did an ultrasound, and the baby's heart rate was, I think, 169. And they took a lot of measurements and things. They did initial blood work. They did the NIPT blood work, which, if you don't know what that is, that's non-invasive prenatal testing. The purpose of it is to see if it's not a diagnostic, but it will give you a risk assessment for certain chromosomal abnormalities. So because of my age, I went ahead and did that. And they basically came in and talked to me, and, they're like, oh yeah, you're about 10 weeks. They said I was like measuring, for my last menstrual period, I was measuring like 4 days behind, which isn't uncommon. So they kept my due date the same as it was based off of my last LMP. my LMP, last menstrual period. So that makes me due July the 4th, technically. And they told me, and this is where it kind of clicked with me why I was having the cramps. They told me I had a cyst on my right ovary, and that's where I was having cramps in my lower abdomen, but especially on the right side. So that clicked with me, like, oh, that's probably why I've been having cramps. And they said it was pretty big, so they were going to keep an eye on it to see, you know, if it changed size, if it got bigger, if, you know, they said that it probably wouldn't cause any problems with the pregnancy, but when they get bigger like that, they can flip, I guess. And if that happens, it requires like an emergency surgery to remove. So I was a little freaked out because I'd never had an ovarian cyst, okay? Like, I'd heard people talk about them and say, oh yeah, they're really painful and blah, 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 and yeah, they're really bad. And I'm like, well, I have no basis for comparison because I've never had one. So now I know what people are talking about when they say they're really painful for some women. For me, it was like that. It was very painful. Like, it was bad. Like, there were some days, like, I would not be able to get up out of bed until, like, 1 o'clock in the afternoon because I was, like, cramping and, like, nauseous and all the other stuff. So, excuse me, they said they would keep an eye on it, and, you know, if I was in, like, a lot of pain to go into the ER, because that might be an indicator that it flipped, or if I started bleeding, blah, blah, blah. So I'm like, oh, okay. So they gave me a packet of stuff, and it had, like, what medications you can take, and just some information about pregnancy in general, like when you could go and tour the hospital and stuff like that. And that was pretty much wrapping up my first appointment. And then they set my second appointment to January the 8th. And then I really continued to have those bad symptoms for a while, like 10 weeks, and then, 11, 12, 13. I think it started to ease up around 14 weeks, which is not uncommon. A lot of women will experience like a relief in symptoms when you get into the second trimester. So it still continued to be rough after my first OB appointment. And in the midst of that, I had other doctor's appointments. They found out I have a heart issue, a couple of heart issues, maybe 3, I don't know, because I know when they did the echocardiogram on my heart, it was abnormal, and there was like some kind of issue with like the blood flow not being able to be measured in the right ventricle, I think. But I was diagnosed with left ventricle hypertrophy and an arrhythmia, so I was freaking out about that. And I'm seeing a pulmonologist because of other issues, so it's just like, oh, it was a lot of appointments. And I'm still not done. I've done some of the major tests that they wanted me to have done. I did a sleep study because I also have like issues with my lungs. Like, I won't go too much into that, but I've had a chronic cough for like years and years, and there's also a neurological component, and like, just, they're trying to piece things together, and it's just being pregnant with all of that. I'm like, oh my God. And in the middle of winter, okay, like in the middle of winter. So the PFT, for example, the hospital where I had it done with, I'm not as familiar with it as my husband is because I'm not from this area where I live in now. And the first time I went to the wrong place. So the first time I went to go get it done, I went to my pulmonologist section of the hospital, and they have little rooms in there that are like labeled PFT. And I'm like, okay, this is where they do pulmonary function tests. No, that is not where they do them. They do them in a whole other side of the hospital. So I had to reschedule that one. Then we got snow, and that's what I'm talking about with the winter, like the bad weather, like trying to get to these appointments, and I'm like, I'm about to lose my mind. I am. So getting into my second trimester, which I'm in my second trimester now because I'm 18 weeks excuse me, sorry, 18 weeks and 3 days, I think. I do feel about it better. I still get nausea, and constipation is still something I struggle with. And the cramping has gone away. That's another thing I wanted to talk about next. So the cramping got even worse, like from my first appointment to my second appointment, which was my first was December the 8th, my second was January the 8th, 2026. So like about a couple weeks before my second appointment, I started having horrendous cramps. Like, I thought I was going to have to go to the ER. I have a really high pain tolerance. I do. Like, I've torn ligaments, I've broken bones, and delayed going in to the ER, which isn't good. I'm not saying that's good, but I'm just giving that as an example of how high my pain tolerance actually is. And I was in a lot of pain. Like, I was like laying down a lot. I'm not a napper. Like, I don't take naps, but I was like laying down, and like literally those 2 weeks before my next appointment, I'm like, oh my God, like what is going on? I thought I was going to have to go to the ER several times. I didn't, and I didn't start bleeding or anything like that. So I'm like, well, it's the cyst. Maybe it's got bigger. So we go into my second appointment, and they did an ultrasound then too, just because, like I say, they wanted to keep an eye on the cyst to see if it got bigger or what was going on with it, to keep track of it. So they said it resolved. So I'm guessing when they did the scan and they saw that it wasn't there anymore, I'm guessing those 2 weeks prior, it probably popped. It probably burst. Is probably why I was in even more pain. So it resolved, and that was good news. And the baby's heartbeat at that point was 155, I think. And they did measurements. They said everything looked good, everything looked normal, everything looked on track. And they did my early glucose tolerance test, which was the 1 hour, which, if you don't know what that is, it's a test to see if you're developing gestational diabetes. So basically, you drink a high sugar drink, which it had like 75 grams of sugar in it. That's a lot of sugar, you guys. It's a lot of sugar. 75 grams of sugar. So they draw your blood first because they need a baseline for comparison, right? So they take your blood first. You drink the 75 gram sugar drink. And it was orange flavor, but it was still gross. And then you wait an hour and they test it. And then you wait another hour and they test it. So that came back clear. Now, of course, that doesn't mean I won't get gestational diabetes, but I hope I don't. They also talked about referring me to maternal fetal medicine because of my age. The NIPT test came back all clear. Again, that's not a diagnostic, but it's a risk assessment, and the risk for the baby having any chromosomal abnormalities for that test, like there are other things outside of that it doesn't risk assess for, but for like the trisomy 18, 22, Down syndrome, things like that, very low risk. So that probably means that the baby doesn't have any of those things. It's not a guarantee because it's just a risk assessment. So that came back low risk, which I was happy about. And I have an appointment with maternal fetal medicine March the 3rd. It was February the 26th, but the doctor isn't going to be in that day, so they had to reschedule. And my next appointment is actually this week. So I might do another video updating on that. I don't know, I don't think they're going to do a scan that day, but they might schedule me for the anatomy scan, because I'm getting right around that time for like an anatomy scan. So we will see about that. And I am on low dose aspirin to prevent preeclampsia. So I take 81 milligrams daily, chewable. It's like a baby aspirin. And research has shown that that can prevent preeclampsia, which is basically like your blood pressure goes really high and it doesn't go down, and the only thing that will fix it is delivering your baby. So hopefully I don't get that. So that's basically how things have been going. The second trimester is a little easier than the first. I would say significantly, with the morning sickness and stuff. And we do know the gender. I don't think I'm going to talk about that in this video. I didn't want this video to be that long. I was looking to see how long it was. Like, oh, it's getting pretty long. So I think that brings everything up to date from when I found out I was pregnant to now. And there are other things that I want to talk about, but I'm not going to try and talk about it in this video. We'll kind of save that for a later time. And like I say, I might talk about my appointment this week, which is just going to be a standard appointment where they weigh you, they check your vitals, things like that. I am going to mention to them that I've had a cold, because I haven't been running a fever, but I've been fighting like this cold or whatever it is for like about 4 weeks now. And your immune system does decrease a little bit when you're pregnant, but my issue is it's been going on for like a long time, and like I'm having pain in this lymph node, and my throat keeps going from like being sore to not being sore. It's really weird, like to the point where it like hurts when I swallow, and then like a day or so it'll be like it feels like it's going away, but it doesn't. And I've been coughing. Now my sinus drainage has been better, because I was like really congested and stuffy at first, but whatever it is, it just doesn't seem like it wants to go away. So I will probably mention that to them this time around and see what they say. And I'm hoping they'll do an anatomy scan with my OB. I think they will, but I think they'll probably have to like schedule it for another time. I don't think they're going to do it this time. But since maternal fetal medicine had to reschedule, I would be like close to 25 weeks before my appointment with them. So I mean, the anatomy scan is something that I'm wanting to get done and over with, because that's like another hump where they look to make sure everything is okay. Like most people only focus on the gender. Like they're like, oh yeah, the NIPT, I'll get to know the gender of my baby. Like that's not my primary concern. I want to know that, you know, my child is healthy. So I feel like once we do the anatomy scan, excuse me, sorry. Once we do the anatomy scan and get over that hump, it'll be like, okay, now I can kind of breathe and relax a little bit, because I feel like I've been like really stressed out, like wondering if everything is okay. And you know, you find out one thing looks okay, but then okay, you have to get this other scan and these other tests, and it's just like one thing after the other. So I feel like I will have some anxiety relief once we get the all clear on the anatomy scan, which hopefully that does go well and everything looks good and there aren't any problems, you know. That is my hope. I am pleased about the gender. I would have been happy either way. Like, I don't have a preference. My husband didn't have a preference. But my main concern is like a healthy child. So we're hoping for that. And that pretty much wraps up my craziness from like when I found out I was pregnant at 42 till now, in my second trimester. But I will update again and talk about and tell what's going on in another video. And then I'm going to get off here. And if anyone is watching this, I hope you have a good night. I hope you're safe. And I hope it's not too cold where you're at. And we will talk to you later. Bye.